The idea of individual care for patients with PV, I think, is extremely important. So the first important consideration is the patient's overall risk of thrombosis. We have to learn the patient's disease in terms of what are their phlebotomy requirements. Not everybody will have the same phlebotomy requirements. And so I think when somebody is initially diagnosed, it's important to get frequent blood counts to really try to determine, is this somebody who needs to be phlebotomized every month, every 3 months, every 6 months? That's one important step. The second thing relates to a patient's general medical conditions. We know that things like having diabetes, having high cholesterol, and having high blood pressure increase the risk of having a thrombotic event even more. And so those are things that we need to optimize in a patient with PV. So it's important to assess those things when meeting a patient for the first time and to do things to reduce those risks. The third thing relates to a patient's symptoms. We know that patients can have variable symptoms in PV, and so it's important to understand what those symptoms are when meeting a patient and to do what we can to optimize the patient's symptoms. Some patients are largely asymptomatic. On the other hand, we have patients who are quite symptomatic. One important thing to remember is that that doesn't always relate to a patient's hematocrit. Patients can have what we would call a controlled hematocrit but still be very symptomatic. And so for that reason, it's important to take a very thorough assessment of a patient's symptoms when assessing their overall status as a PV patient. The important point, I think, is that we can't put all patients into one box.